In June of 1993, John and I went on a vacation and left our children, our two young boys, with a babysitter. And when we called home to find out how things were going, we found out that our youngest son, Colby, had slipped under the water. He was 14 and a half months old in the bathtub while the babysitter was out of the room. And consequently, he was on full life support. And finally, they told us that Colby was brain dead. Well, John being a physician in the community, we had a couple friends come in and confirm that, in fact, Colby was brain dead. And at that point, even with a medical background, we still didn't know what to do. Then one of the doctors at the time came up and asked John and I if we would be willing to donate Colby's organs. Here we are. Here he is. He's family practice physician, had worked ER, had been a director of an ER at the time, and that never crossed our mind. When you are in a tragic situation and this is your baby, that's the last thing that you could think of. And so when that doctor asked us, it was the first time in that tragic situation that we had hope. And it gave us a little bit of power and control, because this was a totally uncontrollable situation. We had no control. There's nothing we could do. And when he asked us to donate, it was the greatest gift that we've ever received, because we were able to say yes. And because of donating, our lives are full today. I get to talk to you guys. I get to encourage future physicians about simple life and death and the joy of being able to give life. You empower the family by asking the question. One of my hopes for the future is that all future physicians, that they'll just have it. It'll just roll off their tongues like a regular question in their H&Ps. Are you a donor? Have you talked to your family about it? Because that's how it happens. And we need to educate our families and let them know our wishes, because in some states, the family has to make the consent. You have the power to ask them, to remind them, to let them know. Just as you're asking them, do you smoke? Do you drink? Do you, whatever, go on a diet, exercise, wear your seatbelt? Are you a donor?
In transplantation, like anything else, when you hear hoofbeats, look for horses. And the predominant site of bacterial infection in a transplant patient is going to be the site of the organ transplantation or the surgical site itself. There's just no other way of putting that. And you need to have a logical framework to evaluate these patients, because so many of them get fevers unrelated to any infection. Most of these transplant patients can mount a good response to infection, but generally it tends to be somewhat diminished. Instead of a fever at 103, their temp may be 100.8, if a fever at all. Some of the anti-rejection medications, specifically the anti-metabolites, which two main ones, mycophenolate and azathioprine, they may not get a fever at all if they're on those medications. And there are common risk factors for all transplant patients. Number one, they've all been in a hospital. Number two, generally ICUs. Number three, they're all on immunosuppressants, which tend to change your immune system. Antimicrobial choices in a transplant patient are very complex for two simple reasons. Number one, drug interactions, and their physiology is a little bit different. And in our early post-transplantation period, which is day 0 to day 30, day of surgery to day 30, opportunistic infections are generally absent. And why? Because they're not fully immunosuppressed. Now we have the late post-transplantation period, over 6 months. These people really are no different than if they never got transplanted. They generally are pretty healthy. Their immunosuppression, we've actually backed off. If they get infected, we actually stop immunosuppression. You have a few days. It's not like if you stop it 10 minutes later, they start rejecting. We're actually inheriting a more virulent, albeit easier to treat, MRSA. In spite of all the lights and the cool monitors and the things that we can do to patients, once a day, just ask the patient how they're doing, though. Without asking them while you're looking up at their monitor, look at them in the eye and say, how are you doing today? You know, what do you need? When you look at all the gewgaws on the walls, don't forget about the patient.